use the panel identifier to, for example, for diabetes, we have reminders in our electronic medical record. If the patient is diabetic, we have a reminder that comes up every 3 months for their A1C, their hemoglobin A1C, so one of the diabetic blood works that we do. So that's an example.
I take those patients then, and I check to see what screenings they're eligible for, whether it be for cancer, any blood work that they are needing, you know, dependent on any medication they're on or their age. Well, I think the biggest benefit of doing this prior to the patient seeing the doctor is that it stops them having to come back to see the doctor for a second appointment to get the results. And so therefore they have the blood work, they have the results of any screenings that they've had. When they come in to see the doctor, it all gets discussed at that one appointment. The best way I'd say that we can manage a patient population as far as their diagnosis goes is we can do searches within the doctor's panel to see who has been diagnosed with such as diabetes, and then we can attach reminders or diarized notes to let us know when their blood work is due and when their next follow-up with the chronic disease management nurse is, or with their doctor.
In addition, I think that it really helps ensure that things don't get missed. Again, as I talked about, sometimes we get busy and someone's coming in for a complete exam. There's a lot of different things that we need to discuss, and so it's good to have the panel managers. They sort of go through the patients at the beginning of the day and they identify any things that might need to be talked about that are overdue, such as screening, smoking cessation, those sorts of things. And so they can make sure that those things are highlighted in the EMR so that we know to talk about them and that we know to bring them up. It just helps kind of make that process much more easy. So the clinic team, really does make for better patient care. Again, we all have sort of certain things that we need to think about, and having different people focusing on different roles kind of helps to make sure that all those different areas get covered. And so while as I might be thinking about, ensuring that their medication review is done, our panel manager may, highlight to me that they haven't done their diabetic blood work in 3 months, and that perhaps we should talk about that as well. So it just really helps make sure that the comprehensive care of the patient is looked after. I think having a panel manager is a very, very valuable addition to a clinic. I think, as I said, it really increases efficiency, so patients can have their screening test done before they even come to their physical exam, making 2 appointments one. And it also, as I said, really improves the comprehensiveness of their care and ensuring that things like their cancer screening aren't missed, or that they're at least brought up a few times so that they do have time to sort of make an informed decision about that. I think that having panel managers is beneficial to the healthcare system as a whole because it really does take a bit of a load off of physicians who are often already busy and have a lot on their plate. And in that way it sort of ensures that all the different parts of patient care are looked after. Patients do start to form a relationship with their panel manager as well if they talk to them on the phone on a regular basis. And it's just sort of another area where they can bring up concerns, and the panel managers can pass it on to us. And I think it just makes for a good comprehensive team management of patient care.
Panel management is a very small term for a very large job. It has potential for great rewards in understanding who your demographics are, who your patients are, who your patients belong to, who their primary physicians are, and to direct care for a particular group of patients in the area. There's some opportunities for goal setting within the clinic once you have your panel clean and sober, as Dr. Webster always said, and it allows us to goal set in that we can clearly identify how many patients are diabetic. We can identify how many patients are diabetic, say, and within target. We can identify people with chronic disease and set up programs for smoking cessation because we know exactly how many patients are in that group of people. We can also identify and create concrete lists of patients that are due for their screening and recall them accordingly if we need to. We also use it to identify patients on particular medications that have maybe been discontinued, or they can be recalled for medication reviews In total, I think I've created about 110 searches just for recalling information purposes to improve patient care.
Panel management is something that I don't really do too much of personally. I just kind of direct Suzie, who is our poet, to organize it, and then it magically gets done and she comes back with a new list every so often, and we take it from there basically. Well, we've gone further than, once they set up the who's who and which patient is my patient, we've gone much further than that to develop a bunch of screening, basic screening tests for patients, as well as drug profiles, lab testing that needs to be done. So that is really where the payoff is in panel management as far as I'm concerned. When Cicely, who's our patient navigator, she updates that list as well, so does Bridget. So they all do their thing, let's say, and then I do what I do, but also sort of guide, at least I like to think I guide, but maybe I don't. I like to think I guide the direction of where we're going, and then quite often I'll say to Suzie, this is what I want, and then come back with me when it's all ready to go. And that's kind of how it has worked in our clinic anyway. For the most part, I don't even book the PAPs. The medical office assistants, if they see that rule is there, they will talk to the patient and they'll book them right off the bat. I don't even have to do anything with it. Similarly with mammograms, or colon cancer screening, all those things are done for the most part before I even see the patients.